In early 2020, a new virus began gathering headlines all over the world because of its unprecedented spread of transmission. Its origin was traced all the way back to the food markets in Wuhan, China, in December 2019. At this point, you all know what I'm talking about. The virus COVID-19, which official name is the SARS-CoV-2. It's responsible for tens of millions of infections globally, causing 1.5 million deaths. The United States actually has the most affected. It's heartbreaking, but we all know that we're in a pandemic. I especially want to talk about this COVID-19 virus. Even though I know that there's lots of information out there, I want to come from a personal note because it's hit home. I'm a family physician, so I see patients, different conditions. And COVID, we treat minor manifestations, but when it hits home, it was completely different. And so that's the take I'm going to come from this afternoon, where I talk about what we need to do to guard ourselves, even as it appears where we're maybe in the second or third stage. I want to provide information that can transform us and help us to triumph as health champions. As I provide an overview of COVID-19 signs and symptoms, it's going to be like a refresher course, okay? Because I'm sure you know somebody that's either been treated or been affected by COVID. So we're going to talk about signs and symptoms, complications. What are those risk factors? What are those diagnoses? How do we prevent it? How do we treat? And I'm going to debunk some of those myths that are out there. So I'm Dr. Babs. If you are meeting me for the first time, stumbled on my YouTube channel, welcome. Thank you for stopping by. I'm a board certified family physician. I am the founder of Living at Your Finest company. I'm a health and a fitness coach, and I'm a woman that is thrilled that you're stopping right by at my channel, Living at Your Finest with Dr. Babs. I want to ask, if you don't mind, if you have not subscribed already, go ahead and subscribe. Don't wait any further. Make sure you hit the bell, right? So that you get an alert anytime a video is released. And while you're at it, share with your friends and family. It's all about being healthier together. Now, we are going to go into the Health Exchange chat room. I am particularly excited today because I have my mom as our guest in the chat room. She's had a personal experience, as I already alluded to, with COVID, and she survived. I give God the praise, and I thank all my prayer warriors that prayed along to ensure that she got a complete healing, and all the other people that were involved in her treatment plan. So she's here to share her experience, and she's going to ask us some questions. So let's hop right in. Hello, happy Sunday to you all. I am so honored that I have my own mom in our Health Exchange chat room today, in person of the retired Deputy Chief Registrar of Court of Appeal in Nigeria, Barrister Funmilayo Adeosun. Thank you so much for honoring us today with your presence as we dive into your experience with the deadly virus COVID-19. Welcome. I want to start off by just giving the Lord the praise and all the glory. Because of him, she's alive today. And I want to take the opportunity to just say a word of prayer for all those that have passed to this deadly disease. May their soul rest in peace. Now, let's get into this conversation. I have a few questions for my mom today, as she just battled the COVID-19, spent 14 days on admission. I would like to find out from her if she can share a little bit of the experience, because of course I was privy to what had happened. She thought it was other things and she was being treated for other conditions, but ended up finding that it was COVID. So I'm going to turn to her now and ask her those specific questions. What happened? Can you share with us your experience?
Thank you for having me here, and I'm glad to share my experience so that it could help some other people who will be suspecting whether it is coronavirus or it is malaria or it is cold or it is whatever. I'm sure it will help some people that will be listening very well. Thank you.
Yes. So can you tell us what you noticed? What was the first symptoms that you had? And why did you think it was something else other than COVID?
Yes. Actually, I got this thing from close contact. Went to a church for a burial service, and we all got excited to be close to the widow, and everybody turned out in numbers. The row which I sat, there are about 10 of us there, instead of about 4 people. We observed the mask, but we were all breathing through. The place was crowded, there was no ventilation, and that was it. We were all there. So the following week, the person I sat, the third person I sat with, called me and said, well, what happened at that burial, we were also close, that he was feeling funny by the end of the following week. And he went for a test and he tested positive. So he told me, I was shocked. I said, oh, I said, I sat the 3 something with him. I said, what did you not do? He said they asked him to go to rehabilitation and he still refused because his family lives in America. It was COVID that stopped him. He would have been there since early last year. He said we would not go to rehabilitation center because he might be abandoned there. Nobody will come to see him. The following week exactly, I started coughing. I thought it was just cold and there is nothing to that. And in this place, in Nigeria, unlike America where you have to bring doctor's prescription to many things, here we patronize the chemists rather than doctors. Well, I called my young lady pharmacist that has a shop behind where I live. I told I was diagnosing it myself. I said, I have a dry cough. He said, Mommy, dry cough. I said, yes, it's dry cough. He said, okay, send your driver, Mommy. I will send the drug. You can transfer the money. So the driver went, brought the medicine. I looked at the medicine. I said, what is it? He said, within 2-3 days it will go. I started using it. 1 day, 2 days. The 3rd day, when I didn't notice any improvement, I just abandoned the thing and was hoping something magic would happen. It didn't happen. It got worse. And I called, the pain now came all over my body, from head to everywhere painful. I called this lady again. I said, he said, Mommy, what happened? I said, I have pain all over my body. He said, Mommy, send your driver. That is symptom of malaria. I said, malaria? He said, yes. This lady was almost, he regretted all that. She was so afraid when I was diagnosed as positive. Because she knew immediately that it is her fault. She should have told me to go and test. Now, when people go and start saying about the malaria or whatever, the doctors and the pharmacy will say, we better go and test for coronavirus because they are all similar. They all have similar symptoms. So he said, really, send your driver. Driver went again, brought malaria drug, and she told me that I should start that evening. And I started that evening. Before I took about 4, I think the malaria drug was about 6. I took 1 in the night. He said, before I took 4 out of the 6, the thing has flown off. I thought, well, it must be malaria. It went on. I finished all the drugs. I finished, but the thing didn't leave me alone. It got worse. Hey, I started coughing so well, and my pain in my body. And along the line, my daughter was phoning. He called. He said, "Mommy, you are coughing." I said, "It's not cough. It is dry cough."
The daughter you're referring to me? Yes, I said yes. The daughter, you're talking about me, right? The daughter, me?
Yes, that's my daughter. Dr. Babs. See,
Yes.
thank God for Dr. Babs and my son, my youngest son,
Yes.
my eldest son, because of coronavirus, he's been working at home. He works in Lagos, but fortunately for me, God has planned everything. So I give glory to the Almighty God
Amen.
for keeping alive to today, because my son was there. When she calls, she will be asking that one questions. What is wrong with mommy? Mommy was still doing agidi. No, it's malaria. It's this. And the thing got worse. And my daughter will say, "Mommy, this is how many days now you've been coughing." And you say you have pain in your body. And I was still arguing with her. I said it's not important. But you know me, when I have cold and it looks like a serious matter, that it will soon wind up. When the thing was turning to 5 days, 6 days, she kept calling. My son here told her that I've never seen mommy in this mood, because it got worse daily. By the time it was 6 days, I could not breathe again. And Dolapo, when he called, Dr. Babs, when she called, she said, "Mommy, we are into serious problem, because this can obviously not be ordinary malaria. It should have gone wide up." And so she started making calls to people here to help me, the CMD of one of our hospitals in Lagos, and her husband's brother, elder brother, who is an
Yes.
ophthalmologist with a big hospital in Abuja. They now call me. Dolapo has just called us now. "Mommy, what's wrong with you? How are you feeling?" I was coughing very well at that time. And both of them are doctors. So they knew that. They said, "Okay." One got me an appointment with the place I would get my test done within 24 hours. Then the other one was checking randomly whether the report was out or not. They were linking up together. The following day, they said I was positive. By that time, I could hardly breathe. And my son was carrying me, "Mommy, lift him up." So as soon as it tested positive, the CMD, Chief Medical Director of Luth, now said, "Okay, you need to go hospital right now." Well, positive, everybody was panicking in my family, in the church, people that knew that I told. But Professor Bodi, the Chief Medical Director, told me that, "Mommy, testing positive does not carry a death sentence. That as soon as you get to the rehabilitation, something, you'll be treated, but you have to be there for 14 days. At that point, I just handed myself over to God. I could not breathe again. I was coughing randomly. I could not eat anything. That was the aspect that caught me, that I didn't notice, because I love food so much. When I was looking, my son prepared pap for me, ordinary pap. I was just looking at it. I could not take it. And the sense of smell, I don't know about sense of smell. I know my sense of smell was very good, but I can't remember whether it was on or not. But the aspect of food, oh, that's the signature of that illness is you will cough, and then you will have nothing to do with food. You will look at what your favorite food, like that, you can't touch it. So by the time I got to the rehabilitation center and they started working, I was glad I didn't choose the teaching hospital, because that place was full of. The place I chose, I used to just watch over it in the television. I said, that seems to be a quiet place. Take me to that place. My God will wait for me there. And that was exactly what happened. They were so diligent. As soon as I got there, they told me that they have not recorded any death in that center, and they've treated more than 600 people. Very amazing. And the way they were treating me, I knew that this place is good. The oxygen, my oxygen level was 82%. I think I had Dr. Bass calling one of them and saying, what's the oxygen level? When they say 82%, he said, oh my God, I had that screaming. They said, no, we are on top of it, it's okay. When I got there, I was the oxygen morning, night. When the thing stopped, they went and brought another mobile one. I said, this place in this, no, they were so fantastic. For 8 days, the first 8 days, they were giving me their drugs and I couldn't eat. They told me, Mama, you will eat because you want to be well. By the time they finished with their drugs within 8 days, morning, afternoon, after meal, and I was showing improvement. They sent my son to get injections to prevent
blood clots.
Blood clots. And I responded so well. Once the oxygen matter was taken care of, I started going out. It was increasing. And by the 8th day that I was there, the thing was coming to 95 and 96. I think it was about the 9th day or 10th day that they took the whole thing off me, because night and day it was really. So I give glory to God.
Yes, thank you so much. Thank you so much for sharing your journey with us. I really appreciate you for taking your time. This would definitely benefit people that are hearing. There are key things that you said here. Symptoms are similar. You know that you can never tell if it's malaria, if it's GI problems, if it's just a mild cold. So please, for our listeners, our viewers, any symptom you have, do not minimize it. Seek help right away. Don't wait 1 or 2 days, 1 hour. Seek help and be your own best advocate. As my mom said, she did say that the pharmacist, and back in Nigeria, most African countries, the pharmacists are, and they're great people. They're great. They're great part of the healthcare system. But in terms of understanding a specific symptom, it needs to be diagnosed by a physician or an upper, a nurse practitioner prescription, and then the pharmacist will issue the medication. So we need to take it upon ourselves to be our own advocate. Thank you, Mommy, for sharing your story. Do you have any questions that you want me to debunk when I go into the discussion room? Because I'm going to talk a little bit about COVID and a little bit about the vaccine. If you have any questions, I'm happy to debunk it in the discussion room.
I was afraid of what I will face out of the place. And there was no need to be afraid, because it was just okay. By the time I got home, everything is back to normal. I was asking for my favorite food, and I just got into the system again. Yeah, I am now. I'm so fine. But I'm not going anywhere again. I'm staying at home, keeping all their rules. The most important thing out of all the rules they give, social distance is so important, because when you sit near, everybody is a carrier. You won't know when you are so close to carrier, and you are your own immunity, like the 60 and above that I was, your immunity will be knocked down, and then you have nothing. You will carry it. He or she will still be going about with his own courage, and you will be in serious trouble.
Yes, well, thank you. Thank you for adding that additional layer. The important thing is, as you said, social distancing. Well, there, Zoom, we still want to have socials, but that's why we have our phones, right? So, yes. But we can have video conferencing, but we don't want to be close, because you never know, anybody is a carrier. And as the doctors told you, the medications that you need to continue on is what you're already taking and what you used to take. And I think that was what really helped you, because you always used to drink water with lemon. I always tell people that my mom's favorite store in America is Sam's Club because you get all the medications, all the supplements there. So you were already building your immune system. I think, of course, to God be the glory, but I think that your immune system was also fighting that virus because it took you 7 days before we even really knew what it was. Well, I want to thank you again, Mommy. Thank God you're alive. You look beautiful. God be praised. So I'm glad that you're strong and you're healthy and you're eating your favorite food. Is that amala? Don't eat too much now.
I lost weight. Oh, I lost weight.
I know.
By the time they took me to the hospital, they put me on my something. I used to complain that I was weighing 92 kilo or whatever. It went straight down to 88.
Okay.
I'm trying to rebuild myself.
All right. Well, thank you very much. God bless you. And so I will make sure that all the questions that you asked about what is the aftercare, I will talk about it in the discussion room. Well, God bless. Stay safe, and we'll talk soon. The coronavirus gets its name from the way it looks under the microscope. The word corona, as you already know, means crown. It's a round virus that has several proteins that it used to attach itself to the host. Coronavirus are zoonotic, and that means that they first develop in an animal and then they're transmitted into a human being. Symptoms are all respiratory droplets that get spread either when you inhale, when you're laughing, talking, eating. Those are the several ways that the respiratory droplets can be transmitted from one person to another. Now, there are several stages that you need to be aware of the COVID-19 infection. The first stage, which we know as the incubation period, and the incubation period is 4 to 6 days average. So the individual is infected, but the viral load is not significant enough for you to even show in the blood or to cause any symptoms. Again, they're all in the upper respiratory tract. And then the next stage is where we talk about the infectious period. So this is 8 to 10 days, starting from 1 to 2 days before the symptoms begin to develop. The illness period is usually about 10 days, full-blown symptoms. Of course, between the infectious and the illness stage, you're already seeing symptoms, and you're also able to pick it up on the bloodstream. Recovery period, the viral load is reduced, especially if they've been under treatment, so the viral count is reduced. Now with COVID, sometimes the test could still be positive even though they've recovered outside of that 14-day quarantine period. The virus is dead, so it's been encapsulated, but it might still show as positive. Now, what is important that we all need to be aware of is you can very well be contagious between 48 to 72 hours before starting to experience symptoms. And what are some of these symptoms that we're talking about? We all know now. We know the most common ones: cough. Some people are short of breath, depending on how severe and how fast it spreads. There's loss of taste, loss of smell. There's also loss of appetite, like my mom had. Bad fatigue, which is feeling really tired. You feel like you've been knocked down by a brick of wood. There's some other atypical findings, meaning that they could have headache, they could have GI. So some people have diarrhea. I've had a patient that was all she had. It was just diarrhea. You need to be aware of those urgent signs: shortness of breath, lips turning blue, severe drowsiness, chest pain, confusion. You want to call right away your emergency system so that you can be transferred to the hospital. As you heard already, because of the way COVID-19 presents, it could be non-specific, right? So it can be confused with flu. It can be confused with a cold-like symptom. It could also be confused with malaria, especially in African countries, because the symptoms are alike. So right now, while we're under the pandemic, you do need to be aware that if you're just not feeling right, don't pause on it. Get evaluated, get checked, see what's going on. Now, a few things that you need to be aware of: complication. Most common complication is the pneumonia, and it has its name as the novel coronavirus infected pneumonia. Based on the statistics, it's shown that the percentage of people who die from this pneumonia after being admitted to the hospital were 4.3% older patients or had pre-existing conditions. Researchers have also seen other complications such as acute respiratory distress, irregular heartbeat, chronic disease, heart attacks. There's also been ones that you've heard about, just chronic fatigue and blood clot. Blood clot is so common because of all the cascade of injuries that have occurred. So these are things that we need to be aware of. It also causes this cascade of inflammatory, multi-system inflammatory syndrome in children. So these are the complications. Again, pre-existing conditions such as diabetes, hypertension, obesity tends to increase the risk of COVID-19 virus. So it seems like it's a suitable host for the virus to multiplicate and cause a lot more complications. Older patients as well have been shown to be at increased risk. Now, how do we take care of ourselves now that we know what the risk factors are? We know some of those symptoms. You want to know how to get diagnosed, right? So diagnosis is so important. Currently, diagnosis is by looking for the virus antigen in the nostrils. All right, so that's how you diagnose it. And the test in some places takes an average about 2 to 5 days for the results to be back. In my mom's case, thank God she got it the next day, and she had already even started treatment. So we need to be aware of how to diagnose and where those locations are if you need to get tested. You don't want to be like, oh, where do I go? You got to know where those testing sites are for yourself and for your family members. The next aspect that I would like to dive into that I think is very relevant is, how do we take care of COVID-19? How do we manage it? But let's backtrack and ask, how do we prevent it? We prevent it by observing the 3 W's, right? 3 W's. First one is definitely watch your distance. Watch your distance, watch your distance. My mom went to a burial ceremony, and they did not observe social distancing. As you already know, anyone could be a carrier. You have no idea. They might not even know. So social distancing is so important. What's your distance for now? What's your distance? Another W is wear your mask. As a matter of fact, that should be the first one. Wear your mask. Wear your mask. Make sure it seals properly. Good seal. Nose and mouth. Not just the mouth. It makes no sense to leave the nose out because respiratory droplets can come out from your nose. So a good seal. Got to make sure you see if you can feel any air coming out. You want to avoid those shield alone and without the face mask. That does not prevent anything. Imagine just having a shield. Respiratory droplets can go in through the shield. And then the other W is washing of hands. You got to make sure that you wash your hands. They say about 20 seconds. I usually encourage my kids, sing a song, say a prayer. Your 20 seconds will go by very fast. So those are some of the things that we need to do. Make sure that we're observing all these CDC guidelines. Make sure that we're disinfecting. Make sure that we're, just maintaining proper hygiene. Now, there are other things that we can do to help us fight against the virus or even prevent getting the virus, right? So eating a balanced diet, very, very important. Eating less crap. When I say less crap, I mean carbonated drinks, refined sugar, artificial sweeteners, processed foods. I do have a video about Nutrition 101 in my YouTube collection. There's also one on building our immune system. So after watching this, please go check that out. We need to eat more foods. So foods, fruits and veggies, organic, lean protein. We want to have omega fatty acids, and we want to drink water. So water helps to hydrate us, helps to keep our soldiers ready for war. Last and not the least, preventative measure is observing the 4S. All right, 4S. So sleep adequately builds a great immune system, helps our body replenish, helps it heal itself. 7 to 9 hours is the minimum number of hours for at least an adult age. It varies depending on the age. You want to make sure that you are avoiding stress, so stress avoidance. So anything that's going to cause stress, it might be best to avoid it because cortisol levels are increased in stress. It doesn't help the body heal and it doesn't help the body fight against the viruses. Last S, last 2S is social interaction. We are social beings, so we need to interact with one another. As you saw, I went on Zoom with my mom. That was very therapeutic for me as it was for her. She got to see her grandkids. I hadn't seen her except pictures, so that was very therapeutic. So social interactions, make sure that you're not isolating by yourself. Call, talk, text. The last S is substance abuse avoidance. So cocaine, marijuana, all those things are not helpful for the body. Exercise. Exercise is good because it keeps us fit. It has so many benefits. Keeps us fit, keeps us stressless, helps us sleep better, definitely helps our sugar count go down. So several benefits to exercise. It doesn't have to be anything too big. Just start where you are and start gradually. And then the last preventative measure I want to talk about is supplement vitamins, so supplemental vitamins. Vitamins, my mom, I always said, as I mentioned, she was always like vitamin C, vitamin D. So you want to check with your provider the exact dose for you, but vitamin C definitely recommended. Vitamin D, I like to get my supplements through my food, but there are some times that you would need, especially like vitamin D, that we might need to have, added as a pill form. So vitamin D, zinc has been shown to build the immune system. So you want to make sure that you are taking that and you want to check with your provider to find what's the appropriate dose for you. Treatment. Now, let's say you do get COVID. How do you manage it? It's really based on the symptoms. There's no cure, but symptoms can be managed appropriately. There's definitely, you're aware of several medications that have been approved, like the remdesivir that was approved for use, but it's under supervision in the hospital. There's blood plasma transfusion. There's also the steroid that helps with inflammation of the lungs. And of course, we do have the vaccine that has been approved by the FDA, granted approval for emergency use. We have the Pfizer and the Moderna. I received and completed my 2 doses of the Pfizer. I was skeptical initially, like others, but I did my research and I found that the immunity that I get from the vaccine is 10 times stronger than if I caught the COVID and had my own immunity against it. I don't know how long it lasts. I don't know if it's sufficient enough, but with the COVID, it's been tested. The COVID vaccine has been tested that it provides a stronger and a longer immunity for me. So I went ahead and I took it. All the issues that we've heard about it getting into your DNA, does not happen. It doesn't alter because it doesn't go anywhere near your genes. I give the illustration that, for instance, you have a contractor that comes into your home to do some work. They just do their work and they leave. Same thing with the vaccine. It comes into the outer part of your cell and it deposits the dead vaccine of COVID, and it stimulates for antibodies so that if you come in contact with the real virus, your body is ready to fight war. So that's how it is. The contractor leaves. The same thing with with the inactivated COVID vaccine. It does not get anywhere near your genes. It doesn't give you COVID. It doesn't make you turn into a robot. My kid said I was going to turn into a robot because of all the information we had. So I trust the science. The benefit of getting it outweighs the risk of me catching COVID, having all the debilitating illnesses, and God forbid, death. So, for those reasons, I want you to do your own research and be equipped with knowledge about whether you're a candidate for the COVID vaccine when it becomes available to you. All this information Very, very important that we are healthier together. Let us eradicate COVID together. Let's do our own part. This too shall pass. We don't want another death. We're tired of all the deaths that we've had. Our heart goes out praying for all people that have lost a loved one. It cannot be easy. I was so nervous and anxious with my mom, and I want to take this opportunity to thank everyone that was part of our treatment plan. My brother-in-laws, Dr. Femi Babalola, Uncle Bade and his family, Auntie Do, all my prayer groups that all prayed along. Thank you so much. Thank my husband, thank my kids, thank everybody. We all prayed. The Larry family, all the families. There are too many to mention. All of you, you're watching this. Thank you so much because we prayed and God heard. And I'm so grateful that I actually called her on Christmas Day. And she was, after 6 days of deliberating on whether it's COVID, not COVID, and I had to scream. I was like, you have to go and get tested. That's the first thing you check if you're not feeling well. Stop playing around with other diagnoses. So I hope that this has empowered you. Please share with others that might benefit from it. And let us get rid of COVID together. There is no shame in it. We just need to prepare ourselves immune system, make sure we're strong in our immune system, make sure that we know where testing sites are, let us know where hospitals are and what treatments need to be done if, God forbid, we come in touch with the virus. All right, so until next time, I hope that you stay informed and transformed and triumph as health champions because you know that you need to, you deserve to, and you most certainly can achieve to live at your finest holistic health. Thank you for watching. God bless.